Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. If you have your book, I would invite you to turn to page 88 in the book, where we are continuing with basic questions and commands. If you don't have a copy of the book, let me use this opportunity to encourage you to get a copy of the book, because that will make following along in these series of videos much easier. You will be able to see what I'm referencing and see the spelling of words. But if you don't have it, you can continue to follow along. But whether you have the book or not, I would ask, if you're interested in these kinds of videos, then hit the subscribe button and you will get notification when the videos are uploaded, as well as to hit the like button if you like these videos. So with that being said, vamos a empezar. On page 88 in the book, I'm going to give you 4 introductory words. Words that you may have or may not have heard before. One of them, I think you pretty much, if you followed a few videos ago when I talked about the body parts, and another one when I talked about hospital personnel, they're actually in that part as well. So the first one is andador. 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 And that is to say walker. That's a walker. The next one is silla de ruedas. Silla de ruedas. Silla de ruedas. And that is wheelchair. Wheelchair. The next one is la enfermera. La enfermera. La enfermera. And that is the feminine version for nurse. Remember that I said in Spanish there is heavy use of genders. So for all nouns, you need to find out whether the noun is masculine or feminine. The masculine version of nurse would be el enfermero. El enfermero. El enfermero. Okay, and the last introductory word is hair. So it's el pelo. El pelo. El pelo. That is hair. Okay, so let's look at the sentences. The first one is, do you prepare your food at home? As you know, that's a question that we as therapy clinicians are always asking our patients, because therapy is not cookie cutter. There are some patients that are, before they come to a hospital or before they go to a skilled nursing facility, they may have been a cook and they were always cooking or baking, making their own meals. There are other patients who they just ordered out food. So you want to be able to find out, when you're creating a goal, a treatment plan for this patient, what was their prior level of function. So this is one of those questions. And this would be, ¿preparas tu comida en casa? ¿Preparas tu comida en casa? ¿Preparas tu comida en casa? The next one, do you speak a little English? Often we can find patients that may say they don't speak English at all. And a lot of times that's done because people may feel, because they're not fluent in the language, that they would rather say, I just don't speak the language. And a lot of it's based out of fear. And sometimes people don't speak any English at all. So if you want to find if they speak just a little bit of English, you can ask them, ¿hablas un poco de inglés? ¿Hablas un poco de inglés? ¿Hablas un poco de inglés? The next one, do you use a walker at home? Do you use a walker at home? ¿Usas un andador en casa? ¿Usas un andador en casa? ¿Usas un andador en casa? The next one, do you use a wheelchair? ¿Usas una silla de ruedas? ¿Usa una silla de ruedas? ¿Usa una silla de ruedas? Now, you also may have heard me use usas or usa. Usas is the more informal way of asking, do you use? Usa is the more formal way. Either generally is accepted. Do you use anything to walk with at home? ¿Usas algo para caminar en casa? ¿Usas algo para caminar en casa? ¿Usas algo para caminar en casa? The next one, do you need the nurse? ¿Necesitas a la enfermera o enfermero? ¿Necesitas a la enfermera o el enfermero? ¿Necesitas a la enfermera o la enfermero or el enfermero? Okay. And then the next one, do you understand me? ¿Me entiende? ¿Me entiende? ¿Me entiende? Or you can say, ¿me entiendes? ¿Me entiendes? ¿Me entiendes? And the last one on this page is, do you want to brush your hair? ¿Quieres cepillarte el pelo? ¿Quieres cepillarte el pelo? ¿Quieres cepillarte el pelo? So we are at the 8-minute mark, a little bit over 8 minutes. So I will stick in the, do you understand what I'm saying? I will say the sentences that we just learned in Spanish and see if you remember what I am asking. The first one, ¿preparas tu comida en casa? ¿Quieres cepillarte el pelo? ¿Hablas un poco de inglés? ¿Me entiende? ¿Usas un andador en casa? ¿Necesitas a la enfermera o el enfermero? ¿Usas una silla de ruedas? ¿Usa algo para caminar en casa? So hopefully you were able to remember what those things meant. Again, gracias por venir, and I will see you in the next video. Adios.